Good afternoon, everyone, and welcome to Henrico County. I'm County Manager John Vitolkis. I'm joined today by several members of our Board of Supervisors, Frank Thornton of the Fairfield District, where we are gathered today, our Chairman, Dan Schmidt, of the Brooklyn District, and Mr. Tyrone Nelson of the Varina Magisterial District. Ladies and gentlemen, none of what you see before us would be possible without the support of leadership from our local elected officials. As we have managed the many challenges of COVID-19, every stakeholder within our community's ecosystem has needed to become more nimble and more innovative. It hasn't been easy, but we have learned a lot about testing, social distancing, mask wearing, contact tracing, and now thankfully, vaccinating. Now, before I yield the microphone, I would like to express my sincere gratitude to our Governor Northam, and his incredible team for their efforts during this crisis. I would also like to reiterate for the Governor and all that our county, Henrico, stands ready to lead our Commonwealth on the vaccination front and what we hope will be the final phase of the pandemic. Ladies and gentlemen, without further ado, Governor Northam.
Well, good afternoon, and this is another exciting day for Virginia. It's an exciting day for Richmond and Henrico County, and it just so happens that today is the one-year anniversary of our first case of COVID-19 in the United States. Our first case in Virginia was on March the 7th up in Northern Virginia, and as John said, we have come a long way since that date, but we still have a long ways to go. And the excitement is that we have been in a long, dark tunnel for now 10 plus months. And so this vaccination is literally the light and the hope at the end of that tunnel. And so if we all continue to work together, we can get there. And so I would like to take the opportunity to thank first the Raceway, Dennis Bickmeyer, who is the president here. He does so much for our community, and without partners like Dennis, we wouldn't be able to accomplish this particular mission. I'd like to thank our local health departments who have literally been working around the clock to keep Virginians safe. And I want to thank our local leaders as well. It's good to have our mayor with us and other members from the city council. This is all part of the team effort. And then I'd also like to thank the volunteers, especially our medical corps, our volunteer medical corps. Thousands of individuals across Virginia have signed up and made themselves available either to do logistics or to help with the administration of the vaccination. So on behalf of Virginia, I say thank you to all of them. It was clear a couple weeks ago to me that we were not moving expeditiously enough in the Commonwealth of Virginia. And so we made several adjustments. I think you all are well aware of those. First of those was to set goals. Our goal was to initially get up to 25,000 doses a day in Virginia. We're now right around 20,000 a day, so we're close to meeting that goal. And then we will expand supply dependent to up to 50,000 and even more doses a day. And we do that type of math, we set those type of goals so that we can get Virginians vaccinated by early to midsummer and finally get this pandemic behind us. The second thing that we did was brought on Dr. Danny Avula, who is no stranger to any of you. He has hit the ground running. He's been on the job for less than 2 weeks now, but you've seen a tremendous response since he's been on the job. And again, we're up close to 20,000 doses a day. And I commend Dr. Avula. He already had a lot on his plate, and we put some more on it, but he has done an outstanding job thus far. We also have deployed our National Guard in Virginia. They have been very helpful with our testing And now, especially when we can get them back from the chaos in Washington, we plan to put them to work as well throughout the Commonwealth of Virginia. And then finally, we made a policy of if you don't use it, you're going to lose it. And so we have had a very close working relationship with our hospital systems. They are going into phase 1B now. As you know, their initial plan was to vaccinate individuals that are our frontline workers in the hospitals and also in our long-term care facilities, and they are in the process of accomplishing that, and now we'll use their doses to reach out into the communities, into clinics, etc. And I'd also like to thank our pharmacies. We are working very closely with them. As you know, Walgreens and CVS both have federal contracts to reach into our long-term care facilities, make sure that those individuals are vaccinated. We know that they're the most vulnerable individuals out there, so that is moving along nicely as well. Finally, I just want to encourage all Virginians that are watching this today that this is the light at the end of a long, dark tunnel. I want Virginians to be patient. I want them to know that we're going to get to everybody. We're going to do it as quickly as we can. We're going to do it as expeditiously as we can, and we're also going to do it as equitably as we can. So I encourage all Virginians, as a doctor, that this vaccination is safe, it's effective, and when your turn is there to get the vaccination, I strongly encourage you to do so. So we will keep working in our administration, working with the pharmacies, working with the healthcare systems, working with our local leaders, working with our volunteers to do everything that we can to get Virginia vaccinated. The sooner we can do that, the sooner we'll be able to put this pandemic in the rearview mirror, get our children back in schools, get our businesses back up and running, and get back to as near normal life as we can. So thank you all for being here today. Thanks to the Raceway, thanks to Dennis for opening up this facility to us. And without further ado, I'd like you to hear from Dr. Danny Avula. Danny, welcome.
Thank you, Governor. Good afternoon, everybody. I've got to say, as a public health doc, it's a little bit of a rush to be in this place. You know, there are so many things about the pandemic response that are exhausting, the hours and the late nights and just getting pulled at in so many directions. But then you come to an event like this, which is what, as public health responders, we live for, right? We're saving lives here today, and it is incredible to see it in action. And then also for me personally, to be here with my great partners in Richmond and Henrico, and also in Hanover in the Chickahominy Health District, that this is a phenomenal example of collaboration, right? I think when the governor asked me to take a role in helping bridge local health departments and the work at the state, this is a perfect example of where that intersection comes into play. And so, you know, as we've been working to support efforts like this, we're seeing more and more efforts, mass, large-scale vaccination efforts around the state, in Winchester, in Fairfax, in Virginia Beach, and it's just really encouraging that the vaccination numbers are increasing rapidly. You know, we're right at about 400,000 doses, and that gap is going to continue to close. And I will say that moving forward, the effort shifts. One of the things that has been a challenge as we start to plan events over the next couple of weeks is that we don't have the supply that we need. And as you heard the governor say, we're going to have to be patient as we get through 1B. We're going to work really hard to focus on our most vulnerable, the elderly, and those with underlying conditions, and as well at the same time ensure that we create opportunities for folks in that essential worker 1B to get vaccinated. But given the supply demands we're facing, it is going to be a couple months. So I ask that people, along with the governor, that people be patient, that people allow others who are more vulnerable to come to the front of the line and to get vaccinated, and that at the end of the day, everybody who wants to get vaccinated will get the opportunity, and that we will all cross this finish line together, as this is the cause for hope. It is the path out of this really challenging pandemic that we've all been living through for this past year. So thank you all for being here, and thanks for the incredible team, our local health department staff, our local government staff, the Medical Reserve Corps volunteers. It's just an enormous operation and a great display of collaboration. I couldn't be prouder. Thank you. And let me invite my friend Mayor Stoney to the mic.
Give a round of applause to Dr. Avula. Thank you, Dr. Avula. I would be remiss if I also did not recognize the Richmond and Henrico Health District staff, people like Dr. Melissa Varay as well, who's been very, very helpful in this process too. I'm glad that Dr. Avula is on loan, Governor, to you so we can help turbocharge this process of getting shots in arms. And I am even more optimistic today than I was before yesterday after the inauguration of President Biden, that we are going to turbocharge this process and ensure that each and every person can get vaccinated here in Central Virginia. Now, roughly a month ago, I attended my first vaccination event with the Richmond City Health District. On that day, 300 hardworking frontline workers received shots. Now, a month later, they've held over 14 vaccination events across the city of Richmond, and I'm so incredibly proud of the health district staff for putting in the hard work, mobilizing so quickly to ensure that we bring this pandemic to an end. And here's the thing, there is no blueprint to any of this, no playbook for what we're doing right now. However, the health district has stepped up time and time and again, whether it's been testing and now vaccines. They've done it each and every day since the beginning of this pandemic back in early March. Now, for the last month, we've been focused on vaccinating the vaccinators, right? The frontline workers who've been out there up front, in person, ensuring that people get the proper health care so they can survive a pandemic. And now we are going to grow that roster. If you look behind me, the people who are getting vaccinated today moving forward are going to be the teachers out there who have been on the front lines ensuring our children are educated, our children are fed. Also, police officers who strive to keep us safe each and every day. Our firefighters who will, we all know, always selflessly respond to an incident in our communities. These people are our heroes, and we need our heroes to be safe as well, to keep us all safe in the coming months. Lastly, I want to remind everyone that we are not out of the woods yet. We are not out of the woods yet. We cannot emphasize enough that we still have to continue to wear our masks. We still have to continue to keep our distance. We still have to continue to wash our hands. We have to still focus on the fundamentals to keep people safe as we do our best to get vaccines, get shots in arms all across Central Virginia, here in Richmond, here in Henrico. I want to thank our partners, Henrico County, and Dennis Bickmeyer here, the Richmond Raceway as well. Thank you for participating in this. This is the largest, the biggest team project that we've ever worked on as a region, as local governments, and it's going to take each and every one of us from all walks of life to play our part and play our role to make it happen and ensure we get out of this pandemic. Thank you so much. And now it's my honor to bring up the county manager for the county of Henrico, my good friend John Vitokis.
Thank you, Mr. Mayor. You know, as we begin to close out, I also want to recognize the fact that we do have Delegate Lamont Bagby. Delegate Bagby, thank you for being here representing Henrico as well. You know, I also want to say thank you, because the mayor's right and the governor's right and Danny's right. This is a Herculean effort, and I begin by thanking our regional partners, you know, the city of Richmond, but I also want to thank Hanover and Goochland for joining us in this effort. This is a Herculean, a local army of dedicated county, school, regional, health district staff. Think about our school nurses. Think about private partners that have been working around the clock every day of the week to plan and execute these vaccination efforts. But there are some who have simply not slept. And I begin by recognizing our emergency manager locally, Mr. Jackson Baynard. Mr. Mayor, you referenced Melissa Varay, but there's also another rock star in our health department, and that is Amy Popovich, who is leading that local team. And obviously our friend Dennis Bickmeyer for everything you continue to do for our region and being a trusted and accommodating friend. And so, as you're certainly aware, one of the main challenges throughout this whole pandemic has been the availability of resources. It started with PPE, then test kits, and now it's vaccine. So what do? In our county, in our region, we get creative, we get busy, just like we did at the beginning of COVID with testing. We took an approach to augment resources and add capacity through local providers and labs. Now, as of today, our county is third in the Commonwealth for testing encounters, and we worked hard to get there. But there are also other partners that we have right now. We recently learned about efforts in other states to tap additional vaccine supplies by working with local private pharmacies. And so I want to call out Mark Oley of Westwood Pharmacy. Mark, raise your hand, because this is a local businessman that has helped immensely in this effort. And you all need to know that. Our residents need to know that. We would not be able to obtain the throughput without some of the efforts that Mark has put into it. So today obviously represents a turning point. We're vaccinating our police officers, firefighters, and other safety personnel, as well as our teachers and other public school employees. I think the mayor's comments and the governor's comments about waiting your turn are entirely appropriate and poignant. We need to get these folks through first. But by putting shots in arms, we're taking a critical step to protect our most vulnerable frontline employees, as well as those they serve. We're also helping restore our public schools for safe in-person learning. Ladies and gentlemen, this is just the beginning, so stay tuned. Henrico and our partners are planning these efforts to benefit the greater community and our residents. We remember that we work for you.